How are y'all doing today? All right, so we're going to talk about falls and risk management today. Does everybody know who our risk manager is?
Yes.
No? Say. Our risk manager.
Oh, yeah.
Alice Markham.
Go in.
So Alice Markham is our risk manager. So if you have any questions about an incident, if you as an employee had a fall, you would find a Miss Alice. And then as Miss Alice has mentioned, she herself has fallen here in the building. So we're going to talk a little bit about today about some of the reasons why our residents do fall, how we can help them, and then we have a little bit of a demonstration to put people in a resident's position. So why do some residents fall? Balance. They're off balance.
They feel unsafe.
They feel unsafe. They're a little shaky. They have impairments. They're blind. They may be deaf. They may not hear you, see you right.
Low blood pressure.
Low blood pressure. So some medication-wise is hemoglobin's low. So they have maybe some other medical issues. They have dementia, so they have their cognitive impairment. Or it's a new facility, right? It's a brand new place. Nobody showed them what they're supposed to do. They don't know where the call bell is. They just know they need to use the restroom, right? They get up, they get out of bed, and they need one of these bad boys. Anybody have good luck with a mat? Anybody? I'm not impaired at all, and I still trip over the mats. And I know they're there. That's the sad part. The really sad part. Or we forget to what? We go in the room, we're going to change them, we're going to help them out. And what do we do with that bed? We leave that bed up. So when we're done in the room, we just what? All right, we'll see you later, Mrs. Francis. And what's that bed at? The bed's too high. So now Mr. Francis is trying to get out of the bed, and he realizes his feet don't hit the floor. Or he didn't lock the wheelchair before he got up, right? So now he's trying to get up, and his wheelchair is going where? It's going away from him. It's going backwards. All right, maybe he doesn't have the good hand functions anymore. He can't find that call light to help you, so he figures, you know what? Forget it. I'm just going to get up and what? Do it myself. Those are always the fun ones. So what are some ways to help them? Repeat yourself? Okay. You'll be doing that all night if you have a resident with dementia, right? Yeah. What are some other ways to help them? Try to reorient them. Maybe keep a light on in the room.
Make sure call light is in reach.
Call light is in reach. Maybe show them where it is. Clip it to their shirt or their pillow so they don't lose it. Anticipate their needs. So we know that for some reason every day he goes to the bathroom right before lunch. How great. He's got to go to the bathroom right when we're getting ready to go. So maybe a few minutes before lunch, what should we do? Take him to the bathroom. Go ask him if he needs to go or if he needs to be changed. What are some other ways?
Place the bed in lower position.
Leave the bed at the appropriate height.
Low bed with mats.
Low beds with mats, hopefully to help cushion a fall for an injury. Less paperwork.
Anti-lock brakes on the wheelchair.
Analog brakes on the wheelchair.
Brakes on the bed.
Brakes on the beds.
Yes. Some beds roll with the bed.
There you go. Yes? What was the question? I'm sorry. The question was is how do we help prevent falls in buildings?
Oh,
All right, so we want to orientate the residents. We want to let them know where their things are, where they're going, what they need if they need help, how to get in touch with us, right? How about checking on the residents? If you got downtime, do a couple rounds. Go through your residents' rooms, just check on them, see how they're doing. They may need to be in the restroom and they may need help. what do you do if there is a fall? Okay, from the nurse standpoint, you're gonna go in, you're gonna assess them before you pick them up, right? Make sure that there's no pain, bleeding, injuries. Mr. Kenny, what do you do if you find somebody on the floor?
You do now.
You what?
I mean, you gotta wait till the nurse assesses them so you don't move them.
But you're gonna
You know, go get your
go get help? Okay. What about you guys in therapy?
File an incident report.
Okay. You know, get the nurse.
Get the nurse.
Okay. CNAs?
You leave them there and we can help.
Okay. Help. What about you, Miss Eva?
If I find somebody,
Yes. What are you gonna do?
oh, I did my part, yeah, but no, we did the nurse, so somebody said assist me,
Okay.
I don't wanna move them.
All right. So I asked somebody from each department what they would do. And the same census is call for help, right? Get the nurse. Now nurses, when you go in the room, what do you guys do? Okay.
They're not there with.
So we grab an aide and the nurse is gonna assess them. We're gonna make sure that we're doing what? What is the biggest thing? Taking vitals. We need to make sure that we get those vitals. We need to make sure that they have been assessed for a head injury, right? Because we need to know about neuro checks. And then, after we've assessed them, they're good, what do we do? Get them up. Make sure you have help. Okay, don't try to strong arm them yourself because then that can lead into an employee injury. So, say you decide you're going to muscle this Mr. Francis yourself, and you pull your back out. What do?
Call for help.
Workman's comp.
Workers' comp. But how do you prevent that employee injury?
Proper body mechanics.
Proper body mechanics.
Get more people to assist us.
Make sure you have an adequate number of people to help you. How about gathering your supplies and what you'll need before you enter the room? Because that'll help you. Also knowing your policies and procedures. Knowing how to assist these residents. Checking their Cardexes. Making sure that you know if they are a 2 assist, a 1 assist, or maybe they may be a total care where they may need a Hoyer or a sit to stand. It's very important. Some of us who float all over the place, check your Cardexes. Making sure that you find a way to get familiar with your residents. And that prevents their falls and yours, right? Okay. Any questions? Who's the risk manager? Alice. You got questions about a fall? Who do you see? Now, if you as an employee hurt yourself, who do you see? Arlene, Alice, or me. We will perform a drug screen that day. But even if you're not hurt and you're not worried, always file an incident report just to make sure. Okay? You never know if that may cause something the next day. So if you get hurt, file a report. If you don't report it, you don't file the report, it didn't happen. We can't help you. Okay? All right, so I believe there is a test in front of you guys. So we're gonna go through this test and then we're gonna do a little bit of an exercise. How's that? Everybody got a test?
No, right now, man.
Everybody have a test?
No.
We need to know.
Show them, babe. Show them.
All right. All of the following conditions that identify patients at high risk for falling except
D.
Dancing the tango without a partner. Name 3 things to look for in a patient's behavior and cognitive status. Confusion, agitation, delirium, right? What else?
Delayed processing time.
Their processing time. Okay. Hearing. Of all the following are examples of assisted devices except a tennis shoe. All right, so the next answers are true or false. Staff communication, such as answering call lights timely, or, oh, look at that, I'm so sorry. The following are environmental changes that can be done to help reduce falls.
D.
Ensure floors are waxed and polished.
Is that an exam? It should be an exam. It should be an exam, isn't it?
Yeah.
All of them. It got to be ensure floors wax process, right?
Push there.
All of them except. Circle A, B, and C.
All right, all of them except, so we just circle A, B, and C. Just circle A, B, and C.
I just said
All A, B, and C are correct.
Just right to what it
What was I saying?
All right, we're gonna move on. Okay. Staff communication, such as answering call lights timely and notifying the appropriate staff of residents' requests and needs, are fall prevention strategies. That is true. Reviewing residents' falls during shift report and team huddle will help prevent falls. Placing residents in rooms closest to the nursing station is not a good fall prevention strategy. False. Pain is not a risk factor for falls. The side effects of some medication place residents at a higher risk for falls. True. All staff should be educated on fall prevention. Welcome to your education. All right. Yep. Okay. So I need a volunteer. I got you. All right. Come on, Miss Eva.
You know, she loves.
All right. So, in order to know what our residents go through, we got to be put in their situations. We got to what? Walk them out on their shoes, right? Okay. So, we are going to slightly impair Miss Eva.
You volunteered.
Slightly. Well, maybe taking off your own glasses already an impairment, right? All right. So we have residents. It's just Vaseline. And it smells like maybe lotion too. Okay. How you see it? Not well, right? No. Okay. Well, Miss Eva also has a hearing impairment.
Oh, man.
That's a nice costume.
So how many of your residents does she already resemble?
Most of them.
Most of them, right?
Halloween.
All right. So what I want Miss Eva to do is Miss Eva, so she just got here. Hi, Miss Eva. Welcome to the Village's Rehab. How are you?
Fine.
All right.
What? Here.
Trying to hear. Oh, okay. Let me talk louder for you, okay?
We make noise in the background.
Let me. All right. So, Miss Eva, this is your room, okay? So your bed is over here in front of you. You have a chair to your left, and your wheelchair is behind you. Okay? I'm gonna go and get some stuff ready. You have a good day, okay? So, Miss Eva's now in her own room. We didn't show her what she was doing because she should know. She's grown, right? She's old enough. Miss Eva, I'm gonna have you come get in that bed for me. Oh, for God's sake, don't fall, please.
Ball.
I see the white over here.
Left, right.
Go straight.
She's good actor.
Okay. All right, let her get in that bed.
She's good actor. She heard. You're a good actor.
Okay. Don't make me do it sit up and get up, please. All right. So Miss Eva's in here. Miss Eva has to use the restroom. So now she knows typically in most facilities like this, there's got to be a call light somewhere, right? So Miss Eva needs to pull her call light. Go ahead, Miss Eva, find your call light.
Yeah, that's
How many times you walk in a resident room and they trying to find that back light like that, and they all moving like this because they can't see it, they can only feel it, right? Not fun. All right, so Miss Eva, you pull your call light. Miss Eva, my name is Crystal. I'm the nurse here. You have your light on. How can I help you?
I have to use the restroom?
Okay. All right, I can help you with that. I'm gonna go put my gloves on, wash my hands, all that fun stuff. All right, Miss Eva, come on. We're gonna get you up. Come on.
Wait a minute now, hold on.
Well, Miss Eva's hearing impaired. I got a job to do, so I'm gonna get her up quickly. Now she can't hear me, so she didn't know what was going on. So now we got her up. All right, Miss Eva, you can come up. Let's go to the bathroom. What did you say? All right, Miss Eva, we're gonna stand up and we're gonna come sit you in the chair.
Oh, okay. Okay. Which chair? I see another chair over here.
All right, you can see a little bit.
At the side.
All right, so that was a little bit better. I was here to help her, able to assist her. Right? Anybody else want to give it a try?
Good job, Eva. She can hear too good.
All right, anybody else want to try?
Oh.
She said my glasses.
All right, anybody else want to volunteer? Want to give it a try?
I don't mind doing this. I don't need to simulate that.
Miss Debbie.
Debbie got a dress on. Yeah, you got a dress on. You ain't got no spikes on.
Okay, so we'll do the rest here real quick. Have you just slide these bad boys on?
fashion statement.
All right. So we'll let these. Okay. Okay. So what we're gonna do, so Miss Debbie, we're gonna put her in the wheelchair.
If she can hear, that's not fair.
She can hear, some of our residents can hear.
She said
We're
it's
gonna
not
put
fair.
we're gonna put these gloves on Miss Debbie. Oh.
Start scrubbing out.
All right. So we're gonna have, I'm gonna walk you over, I'll have you sit in the wheelchair here.
Why does she have the gloves on?
Because how many of your residents can't
Have our
have arthritis? They have the sensory things. There you go.
Maybe she's gonna come.
Probably can't.
All right. So Miss Debbie has a little cataracts going on.
Looks a little scared.
She probably is. That's how most of our residents look when they first get here, right? They're a little scared. They're a little nervous. They don't know what to expect. All right. So Miss Debbie, I'm going to have you unlock your wheelchair. There you go. Okay. All right. So we're just gonna move Debbie a little bit forward. Okay? All right, Miss Debbie, we're in your room now. You can go ahead and stand up.
Am I doing this?
She's a smart resident.
All right, so she remembered to lock a wheelchair. Right?
It isn't so easy
It's a
though.
trick,
You have
be
to have
careful.
gloves.
All right. Go ahead and sit down, Miss Debbie. Just sit back in your wheelchair. Ooh, he's telling you that he Yeah. It's not so fun when you can't see it, when you can't touch it, and you're trying to sit down.
You can't feel it.
No. Go ahead and stand up without locking your wheelchair, Miss Debbie. All right. That's perfect posture. Whatever. Obviously, most of our residents have some impairment to get up like that. So how was it having the gloves on and trying to maneuver things?
It wasn't easy. No, the gloves make it very difficult.
Glasses are a fashion statement.
Huh?
You're a fashion statement, your glasses.
My glasses are a fashion statement. I should wear those every day.
Hey, Debbie, good job.
All right. So just a quick recap, because I know everybody's anxious to go. Again, what are some things that we noticed from Eva and Miss Debbie? It's not easy. It's not easy when you have those hearing impairments or those vision impairments, or you're in a new place.
They're afraid.
They're afraid. You know, you said it, Miss Debbie, you look scared. But she didn't know what to expect. So if you get scared, you get nervous, you don't think, I gotta lock my wheelchair before I get up. Or you know what? I'm just gonna use the bathroom myself because I've been doing it for years. Or you find these wonderful mats. These mats are everybody's best friend. They drive me insane. I trip over them constantly. Yeah, the telephone wires. What about the call lights? They have such thin strings. Okay? How many of you guys have a resident that just pulls these right out of the wall? All the time. All the time. So maybe if we make sure that we put them to the person, sometimes their nightgowns, their pillows, their sheets. Because sometimes if they do move, it's easier to feel something tugging on your shirt to remind you that that call light is there. Or as simple as going in the room and saying, hey, Mrs. Francis, I know you just got here. I just wanted to check on you, see how you're doing, how you're adjusting. Right? If you need anything, if you need help, you need to go to the bathroom. Or before they go to therapy, what's the biggest thing therapy asks before they go to therapy? You need to use the bathroom. And your meds. You know, nurses, be aware. If you give a patient a new medication and they tell you that I don't feel right, check on them. Your aides, if you're going in the room and they say, you know what, I'm not feeling okay. Stay with them. Check on them constantly. Make sure that you're doing everything that you can to help prevent them from falling. Okay, we don't want them to go back to the hospital when they first get here. We want to be tentative. We want to make sure that they're okay. In the same line, we want to make sure that you guys are okay. We have gait belts. Gait belts are great when you need to help transfer people, get them into bed, out of bed, get them from a wheelchair. Gait belts. If you need a gait belt, you can come see me. I have gait belts. Get a gait belt. If you're not sure how to use it, therapy would love to show you. All right, I've had Christine. She's come to help show some aides how to use the gait belts. Peg will show you. Excuse me, Allison will show you. Anybody will let you know, but you have to ask for the help. And you have to get your necessary equipment to be able to do that. Help protect yourself, help protect our residents. Any questions? No? Who's your risk manager? Alice. Alice Markham. All right. What do you do if you fall as an employee?
See you or Alice or Miss.
See Alice, Arlene, or me. You need to fill out a what? Incident report. Can you write in pencil on that incident report? Any questions? You good? Y'all have a great day. Thank you for coming.